Health authorities and international monitoring agencies have issued urgent updates following a cluster of severe respiratory infections linked to the Andes hantavirus, a rare and highly lethal strain now under intense global scrutiny. In May 2026, the World Health Organization and the European Centre for Disease Prevention and Control shifted their focus to a Dutch-flagged expedition vessel, the MV Hondius, following a deadly outbreak in the South Atlantic that has already claimed 3 lives. This development underscores the core threat of Hantavirus pulmonary syndrome, or HPS, its ability to target previously healthy adults with a speed that often outpaces conventional medical intervention. While most hantaviruses are transmitted strictly from rodents to humans through the inhalation of aerosolized droppings, the Andes strain identified in this latest cluster carries a much more concerning trait: the documented potential for human-to-human transmission. This rare characteristic has prompted the WHO to activate international health regulations, triggering contact tracing across multiple continents as passengers from the vessel disembarked and travelled to various global hubs. +1. The current reporting highlights a geographic spread that began off the coast of Argentina in early April 2026, with the vessel visiting remote regions including Antarctica and South Georgia before the first symptoms emerged. Public health records indicate that hantavirus is not a single entity but a family of viruses, with different strains tied to specific rodent reservoirs. In North America, the Sin Menombre virus, carried by deer mice, remains the primary concern, while the Andes virus is endemic to South America. Despite these regional differences, the clinical outcome of Hantavirus pulmonary syndrome remains uniform and devastating. It typically begins with a deceptively mild prodromal phase, fever, muscle aches, and fatigue that mimics common seasonal influenza. However, for a significant percentage of patients, this phase is followed by a sudden, catastrophic shift where the lungs begin to fill with fluid, leading to acute respiratory distress and shock. The case fatality rate for this specific 2026 outbreak is currently estimated at 38%, a figure that aligns with historical data showing that nearly 1 in 3 confirmed cases ends in death. +4 surveillance data from 2025 and early 2026 further contextualizes the persistent risk. In the United States, states such as Arizona, New Mexico, and Colorado continue to report sporadic cases, often linked to routine activities like cleaning out cabins or storage sheds where rodents have nested. A recent detection in San Diego County earlier this year confirmed the presence of the virus in a western harvest mouse, reminding public health officials that the environmental reservoir is active even when human cases are not immediately apparent. The fundamental challenge for reporters and clinicians alike is the healthy adult factor. Unlike many respiratory pathogens that primarily threaten the elderly or the immunocompromised, HPS is notorious for overwhelming the robust immune systems of young, fit individuals. Scientists believe this is due to an intense cytokine storm, where the body's own immune response to the virus causes the capillaries in the lungs to leak fluid, effectively drowning the patient from within. This framing of the virus as an unpredictable environmental hazard that can escalate into a clinical emergency within hours forms the backdrop of the current international response. The clinical and logistical developments surrounding the MV Hondius outbreak provide a clear window into the complexities of modern hantavirus management. On May 2, 2026, the United Kingdom's National Focal Point notified the WHO of a cluster of severe acute respiratory illness among the ship's 147 passengers and crew. Laboratory confirmation soon followed, with testing conducted in South Africa and the Netherlands utilising polymerase chain reaction, or PCR, and viral sequencing to identify the Andes strain. One of the most harrowing accounts in the official reporting involves an adult female passenger who began showing gastrointestinal symptoms during a stop at St. Helena. Her condition deteriorated so rapidly that she passed away immediately upon arrival at an emergency department in Johannesburg on April 26. A second passenger, a British male, was medically evacuated from Ascension Island to an intensive care unit in South Africa, where he remains in critical condition. These cases illustrate the terrifying speed of HPS. Patients can transition from walking and talking to requiring full mechanical ventilation or extracorporeal membrane oxygenation, known as ECMO, in less than 24 hours. +2. The phrase "doctors are powerless" reflects the current lack of a specific antiviral silver bullet for hantavirus. While research into treatments like ribavirin has been ongoing, clinical trials have yet to produce a definitive cure. Instead, medical intervention is strictly supportive. Hospitals focus on stabilizing the patient's blood pressure with vasopressors and maintaining oxygen levels through invasive ventilation. Because the fluid in the lungs is the result of a capillary leak rather than heart failure, traditional diuretics are often ineffective and can even be dangerous by further lowering the patient's blood pressure. This creates a narrow, high-stakes window for critical care teams. Lab clues that clinicians look for include a rapid drop in platelet counts, known as thrombocytopenia, and the appearance of atypical lymphocytes in the blood. In the laboratory setting, health officials are using metagenomics and serology to track if the virus has mutated or if the current strain shows any increased efficiency in person-to-person spread. +2 logistically, the response has expanded into a multi-country tracing effort. Italian health authorities recently triggered active surveillance for travellers who transited through Rome's Fiumicino airport after potentially sharing a flight segment with an infected individual. These passengers are now being monitored for the maximum known incubation period of 45 days. This level of scrutiny is necessary because the virus can remain dormant for up to 6 or 8 weeks before the onset of the respiratory crash. The ECDC has issued specific guidance for the disembarkation of the MV Hondius in Tenerife, requiring passengers to undergo quarantine and symptom monitoring. The contrast between the suspected cases and confirmed cases remains a point of high tension for agencies, as early PCR tests can sometimes return negative results if the viral load is not yet high enough in the blood, necessitating repeat testing and prolonged isolation for those in the high-risk window. Prevention and public guidance remain the most effective tools against hantavirus, as the medical community continues to struggle with the lack of a viable vaccine. Public health agencies like the CDC and the Africa CDC emphasize that the primary defense is environmental control. Because the virus is most often contracted by breathing in air contaminated with rodent urine or droppings, the method of cleaning these spaces is critical. Officials strictly advise against dry sweeping or vacuuming in areas where rodents have been present, as these actions kick the viral particles into the air. Instead, the recommended protocol involves saturating the area with a 10% bleach solution or a strong disinfectant for at least 5 minutes before wiping it down with paper towels while wearing gloves and, ideally, a high-efficiency respirator like an N95 mask. In the context of the 2026 cruise ship outbreak, the ECDC has further advised enhanced ventilation and frequent hand hygiene, noting that while the Andes strain can spread between people, it does not do so with the ease of more common respiratory viruses. +3 not. This image was not requested and is not relevant. Following the specific system instruction to be economical but strategic, I will use. The honest limit of current virological knowledge is the uncertainty of the spillover event. Exactly why and when a virus jumps from a rodent population into the human population with such high virulence. While over 30 small mammal species have been identified as potential carriers, including ground squirrels and chipmunks, the exact environmental triggers that lead to an outbreak are still being studied. Surveillance programs now involve regular trapping and testing of rodent populations in endemic areas to provide an early warning system for local communities. For travellers and those living in high-risk rural areas, the message from health officials is one of calm vigilance. You should be aware of the symptoms, specifically the transition from fever to shortness of breath, and be honest with healthcare providers about any potential exposure to rodents or recent travel to areas like South America or the American Southwest. As we close this report, the situation on the MV Hondius serves as a reminder of the fragility of the global health landscape. While the risk to the general public remains very low, the individual risk to those exposed is extreme. International cooperation between the WHO, the ECDC, and national health ministries continues as they work to contain this cluster and prevent further transmission. For more updates on emerging public health reports and global surveillance, please consider subscribing to this channel for factual, research-based news. Knowledge of the mechanisms and the risks is the first step in prevention. Stay safe and stay informed. The clinical escalation of the Andes Hantavirus outbreak on the Dutch-flagged vessel MV Hondius has forced a rapid mobilization of international health infrastructure, highlighting the extreme difficulty of managing hantavirus pulmonary syndrome in a mobile population. On May 2, 2026, the United Kingdom's national IHR focal point officially notified the World Health Organization of a cluster of severe acute respiratory illness among a group that had recently traversed the South Atlantic. This notification triggered a complex chain of laboratory diagnostics and contact tracing spanning 4 continents. The core of the medical crisis centers on the rapid physical collapse of those infected. Public health records from South Africa confirmed that one passenger, a woman who initially reported mild gastrointestinal distress while the ship was docked at St. Helena, suffered a catastrophic respiratory failure and was pronounced dead shortly after arriving at a Johannesburg emergency room on April 26. A second passenger, a British male in his 60s, was medically evacuated from the remote Ascension Island and transported to a specialised intensive care unit in South Africa. He remains in critical condition, receiving advanced life support through extracorporeal membrane oxygenation, or ECMO. This machine serves as a temporary replacement for the heart and lungs, a necessity when the virus triggers a total inflammatory collapse of the pulmonary system. The phrase, "doctors are powerless," often found in tabloid reporting, is technically inaccurate but reflects a grim clinical reality. There is no targeted pharmaceutical cure for hantavirus. Medical teams at the front lines in Johannesburg and Tenerife are relying entirely on aggressive supportive care. Unlike bacterial pneumonia, which responds to antibiotics, HPS is a viral assault that results in a systemic capillary leak. This means the blood vessels in the lungs become porous, allowing fluid to flood the air sacs. Because the underlying cause is a structural failure of the vessel walls rather than a failure of the heart to pump, traditional treatments for fluid in the lungs, such as diuretics, are often ineffective or counterproductive. Instead, hospitals must utilize high-pressure mechanical ventilation and vasopressors to maintain blood pressure. Lab technicians working with blood samples from the MV Hondius cluster are looking for specific biological markers to confirm the diagnosis, including a sharp decline in platelet counts, known as thrombocytopenia, and the presence of immunoblasts, or large atypical white blood cells. These indicators, combined with positive PCR results for hantavirus RNA, allow labs to differentiate this lethal pathogen from more common respiratory viruses like COVID-19 or influenza on the logistics and surveillance front. The movement of the 147 passengers and crew from the MV Hondius has created a massive administrative challenge for the European Centre for Disease Prevention and Control. When the vessel reached Tenerife, health officials implemented strict disembarkation protocols, including individual risk assessments and the collection of contact information for everyone on board. Because the incubation period for the Andes strain can extend up to 6 weeks, the risk of a secondary wave of infections remains high. This has led Italian health authorities to issue a high alert notice for Fiumicino Airport in Rome, where several passengers transited before the full scope of the outbreak was understood. These individuals are now under passive surveillance, instructed to monitor their temperature twice daily and report any muscle aches or fatigue immediately. The global shipping and travel sectors are also closely watching the situation, as the WHO evaluates whether the human-to-human transmission seen in the Andes strain requires a change in international travel advisories. Currently, officials are emphasizing that while the virus is lethal, it does not possess the same aerosol efficiency as a common cold, requiring close, prolonged contact for person-to-person spread. This distinction between highly lethal and highly contagious is the focus of ongoing data verification as agencies reconcile initial shipboard reports with the verified laboratory findings from reference centres in the Netherlands and South Africa. As international health organisations and local ministries work to contain the immediate threat posed by the Andes Hantavirus cluster, the focus of the global response has shifted toward long-term surveillance, environmental management, and the communication of established prevention protocols. Public health officials emphasize that while the current outbreak in the South Atlantic is rare due to its human-to-human potential, the broader family of hantaviruses remains a persistent environmental hazard across the globe. Effective prevention is rooted in the understanding of the spillover mechanism, where the virus moves from its natural rodent reservoir into human populations. Agencies such as the Centers for Disease Control and Prevention and the European Centre for Disease Prevention and Control advocate for a One Health approach, which integrates the monitoring of animal populations with human clinical data in South America and parts of North America. This involves systematic trapping and testing of species like the long-tailed pygmy rice rat and the deer mouse to determine the seroprevalence, or the percentage of the rodent population carrying the virus. When these levels rise, often due to heavy rainfall and increased food availability leading to rodent population spikes, authorities issue localized alerts to rural communities and travelers for the individual. Practical prevention centers on the physical disruption of the viral transmission path. Because hantaviruses are enveloped viruses, meaning they are surrounded by a lipid layer that is easily broken down. Common household disinfectants are highly effective. However, the method of application is vital for safety. Public health guidance strictly forbids the use of dry cleaning methods like sweeping or vacuuming in areas with suspected rodent activity, as these actions aerosolize the virus, creating the fine mist that, when inhaled, leads to infection. Instead, the protocol requires saturating contaminated areas with a 10% bleach solution or a professional-grade disinfectant for at least 5 to 10 minutes. This wetting process ensures that viral particles are trapped and neutralized before they can be wiped away. For those in high-risk settings, such as cleaning out long-abandoned structures or handling cargo from endemic regions, the use of personal protective equipment, specifically N95 or higher-rated respirators and rubber gloves, is considered non-negotiable by current safety standards. The honest limits of current medical science remain a significant hurdle in the fight against hantavirus pulmonary syndrome. Despite decades of research, there is no commercially available vaccine for the Andes or Sin no nombre strains. The development process is hampered by the fact that hantaviruses must be handled in biosafety level 4 laboratories, the highest level of biocontainment, which limits the number of facilities globally that can conduct this research. Furthermore, the cytokine storm that causes the rapid respiratory crash in healthy adults is a complex immunological event that researchers are still struggling to modulate without suppressing the patient's overall ability to fight the infection. This uncertainty necessitates a transparent and ethical approach to public reporting. Health officials are tasked with a difficult balancing act. They must convey the extreme lethality of the virus to ensure compliance with safety protocols without triggering undue panic in populations where the statistical risk of exposure remains extremely low, as this 2026 reporting cycle continues. The ethical imperative for global health agencies is the rapid sharing of genomic data. By sequencing the viral genome from the MV Hondius cases, scientists can determine if the virus is evolving toward more efficient human-to-human transmission, or if this cluster was an isolated event driven by the unique, confined environment of a vessel. Calm vigilance remains the recommended stance for the public. This involves a commitment to reporting early symptoms, such as the sudden onset of high fever and muscle aches, especially if there is a known history of travel to endemic areas or potential rodent exposure. By maintaining a high index of suspicion in the clinical setting and adhering to rigorous environmental hygiene in the home, the impact of this devastating pathogen can be mitigated. For ongoing coverage of global health surveillance and emerging viral threats, consider subscribing to this channel for factual, editorially vetted updates. We will continue to monitor the status of the surviving patients and the results of the international tracing effort as new data becomes available.